The urgent PC Neuromodulation System is a simple method of delivering percutaneous tibial nerve stimulation, a therapy often referred to as PTNS. The urgent PC Neuromodulation System is indicated for the treatment of overactive bladder symptoms of urinary urgency, urinary frequency, and urge incontinence. PTNS treatment with urgent PC can be performed in an office-based setting. To conduct a PTNS therapy session, a stimulator and a lead set will be used. Because the patient will remain still during the 30 minutes of treatment, it is important to have the patient in a comfortable position. In addition, the clinician needs easy access to the needle electrode insertion site. Before beginning any treatment session, check the battery level. To check the battery level, turn on the stimulator by pressing and holding the power button for approximately 2 seconds. The battery should be replaced when the battery icon displays only one line remaining. Open the lead set package. Components of the lead set are the lead wires, an alcohol pad, and 2 sterile needle electrodes. The insertion site for the needle electrode is the site most likely to deliver the needle electrode in the proximity of the tibial nerve. Note, however, the goal is to be near the tibial nerve, not to hit the tibial nerve. Identify the insertion site by finding the soft spot above the ankle and behind the tibia. This position on the lower inner aspect of either leg is approximately 3 fingerbreadths, or 5 centimeters, cephalad, to the medial malleolus, and approximately 1 fingerbreadth, 2 centimeters, posterior to the tibia. Once the appropriate insertion site is identified, clean the site using the alcohol pad included in the lead set package. Place the surface electrode on the same leg as the needle electrode insertion. Connect the lead wire to the stimulator. Place the needle electrode and guide tube over the identified and cleaned insertion site. Angle the guide tube so it is at a 60-degree angle in relation to the foot. Hold the guide tube so the lower end is pointing toward the head and in the direction of the tibia. Remove the stop plug in the guide tube to release the needle electrode. Gently tap the head of the needle electrode to pierce the skin. Once the needle electrode has penetrated the skin, remove the guide tube and advance the needle electrode using a rotating motion to facilitate entry or using direct pressure. It is important to maintain a 60-degree angle with the needle electrode while advancing it in a path that is parallel to the tibia. When appropriately inserted, about half of the length of the needle electrode will be inserted in the leg, with the handle portion, about 2 centimeters, left exposed. The next step is to attach the needle electrode clip to the needle electrode, and preparation is now complete. The next step is to adjust the current setting for optimum patient response. This is accomplished using the stimulator's test mode. To begin the test mode, press and hold the test button for approximately 2 seconds. The system is designed so the default current setting is 0. At a current setting of 0, there is no current flowing. When the test mode is started, the LED above the test button will be lit. To determine the optimum current setting for the patient's treatment, a patient's response test must be conducted. Using the current adjustment button, slowly increase the current while observing the patient's foot for a response. The typical motor response is dorsal flexion of the great toe, plantar flexion of the toes, or an extension of the entire foot. Once the patient's motor response is observed, reduce the current level by 1 setting to ensure patient comfort during therapy. The therapy session can be initiated by pressing the therapy button. If there is no patient response, press the stop button and reposition the needle electrode slightly and start the test mode again. If there is still no patient response, discard the first needle electrode. Open the second needle electrode and repeat the procedure on the other leg. After determining a patient's response in test mode, PTNS therapy can begin. Go directly into therapy mode by pressing the therapy button while test mode is still active. The lit LED above the therapy button confirms therapy mode has started. Regardless of the method used to begin therapy, the current setting for therapy will default to the final current setting in test mode. However, the current adjustment button can be used to increase or decrease the current level at any time during therapy mode. When therapy mode is initiated, the treatment time is programmed for a 30-minute session. The display shows remaining time in treatment, with minutes and seconds remaining in the 30-minute therapy session. When the preset therapy time has elapsed, therapy mode will automatically end. The current flow will return to 0. To signal the end of the therapy session, the stimulator will emit a series of 3 beeps. Turn off the stimulator by depressing the power button for approximately 2 seconds. Remove the needle electrode clip from the needle electrode. Remove the needle electrode from the patient's leg using a quick, smooth withdrawal of the needle. Disconnect the lead wire from the stimulator and properly dispose of all of the lead set components. The treatment session is now complete. Conduct 12 treatments, typically once per week. After the initial 12 treatments, slowly increase the time intervals between treatments, watching the patient closely for any return of their overactive bladder symptoms. For example, after the 12th treatment, the patient may come in every 2 weeks for a treatment. If the patient continues well, then every 3 weeks for a treatment. Continue to increase the interval between treatments. If the overactive bladder symptoms reappear or increase in severity, revise the patient's treatment schedule and return to the most recent treatment frequency providing symptom relief. Uroplasty recognizes and thanks Dr. Judy Siegel, Cindy Grossman, and the staff and patients of the Family Urology practice for their expertise and assistance in creating this program.